More and more hospitals and healthcare systems are being granted waivers to perform elective surgeries. And with that comes careful safety considerations. Nikki Dementri explores the new patient experience at the region's first hospital system granted an elective surgery restart.
Elective procedures in the COVID-19 era.
No need to be afraid.
No need to be afraid. We're going to take care of you.
No need to be afraid at Catholic Health. That's the message from Senior Vice President of Acute Care, Marty Borzak. The hospital system restarted elective procedures last week, almost 2 months since pressing pause.
An elective procedure is really anything that's scheduled. That doesn't mean that it's not important. It doesn't mean that it's not urgent. It doesn't mean that someone may not have a chronic issue.
The backlog is staggering. More than 3,500 cases put on hold. Financially, Borzak says the loss is in the tens of millions, but won't give a specific amount. In return, Catholic Health furloughed at least 1,200 employees.
Just like any other health system in the country, this entire COVID pandemic has really, caused a lot of financial strain on our organizations, and Catholic Health wasn't immune to that.
The hospital system was the first in Western New York to get a waiver approved by the governor to resume elective procedures.
And it really said that we handled the pandemic the best that we could, the right way.
Last week saw 150 to 175 procedures across all hospitals. This week grew to 500 plus. What's more, 250 to 300 of the furloughed staff have returned to work.
As more activity comes, the billing, the financial, the back office functions, we'll be able to return more people to work.
Any candidate undergoing elective procedures at Catholic Health in this new normal first needs a COVID test 72 hours before surgery day. This allows at least a day buffer in case the procedure needs to be canceled. On surgery day, the candidate gets paired with a patient escort, someone who literally touches the elevator buttons and leads the way through the mapped out hospitals to ensure maximum social distancing, both before and after the procedure.
When they enter one of our facilities, they will be well taken care of every step of the way. From the time they enter our buildings to the time that they leave, we've thought about everything from patient safety to infection control and how we're going to take care of that person in a COVID world.
Nikki Dementri, 7 Eyewitness News.